Hi, and welcome to Your Business TV, television with information that is positive and uplifting. My name is Laura Hartman, and I am your host. Today, I am excited to introduce our guest. He is the co-owner and CEO of Fluid Health and Fitness, which is a company that does restorative fitness, movement therapy, and body optimization. It's pretty amazing. They have taken fitness to a whole new level. They deliver what a lot of fitness and wellness companies do not. I'm very excited and happy to introduce to you the amazing and wonderful Ryan Maxwell of Fluid Health and Fitness. Well, welcome to the show, Ryan. How are you?
I'm really good. Thanks for having me, Laura.
Yeah, you've been a huge savior for me. Not only my physical body, but also my mindset with what your company does. And I mentioned earlier that you offer what a lot of fitness and wellness experts don't. You're able to identify how the body works and how movement is so important. Can you explain to people exactly what you do in better terms of the way that I've explained it?
Yeah.
And we can discuss how you miraculously saved my knee from having to get injections or even a knee replacement, and also my lower back. I have had very little issues, if any. So
and I think where we start the discussion is the idea of what is the mechanisms behind the reason why people feel pain. And I think oftentimes people they have a very intimate relationship with what they're feeling and the pains that they're feeling. They just don't know how they started and why.
Right.
And so oftentimes, due to just limits and resources, individuals don't get enough education about what's going on in that area or what led to that issue in the body, that they don't have a way of actually correcting for it long term, because they don't know what the mechanism was that led to that injury in the first place. So the philosophy with our protocol is built off of education and knowledge for the person. And we believe that fundamentally the way that you move, which is referred to as biomechanics, is something that should be a learned behavior. Right? We take it for granted, right? When anyone, if you ever ask anyone, did someone teach you to walk? Right.
Right.
Well, it's been a while, like your parents, but did your parents really ever teach you? No one ever taught you how to walk. You just walked, right?
Right.
And the point, though, is that the body has a very specific way that it coordinates the use of its muscles to be able to move your body through space. And there is a process, and there is an optimal process for that movement. And so it's not vague. It's not unknown. These are very documented and well-researched, studies that have looked at the way that the body's intended to move and what is the optimal position for each of the joints when it does move.
Right.
So the thing is, once we know that there's an injury, normally the injury is because there's an acute trauma, so you got into a car accident, right? Or there's wear and tear, which basically means that you move in a way that puts the body in a position where you're going to work more of one structure over another until it breaks down. And then we feel that as pain. And so when we look at restoring a person back to a functional outcome, we have to look at, is this an acute issue that happened on a frame, or was it the frame that led to the issue?
Okay.
Right?
Right.
Or is it both? Right? Because you could have gotten to it in a car accident, but you had poor biomechanics, and so your global symmetry of the way that your body was held together was wrong when you got into that accident. So you have a combination of both acute and chronic, and now we have to figure out how to deconstruct that to get you back to the optimal relationships that we know are supposed to take place in your movement quality.
Right. And so, I probably had that, but my biomechanics was altered or off after my accident, years after. With injuries, I did get treatment. I went through, physical therapy, and I went to a chiropractor, physical therapy, and did rehabilitation. But then it has a stopping point. And so for years, and I mean years with my back, I would work out and then injure myself. And I wait till I get better, try it again, injure myself,
Yeah.
and just
Yeah.
repeat over the years until I'm like, ugh, you kind of give
Well,
up, you know?
and that's it. It's that I think people become incensed by the futility of their effort, right? And then they start to think that that somehow they're fundamentally wrong, or that their body is just, there's no hope for them anymore.
Right.
And they think they've gotten past a threshold point where their age is just taken over and there's no going back.
Yep. Yeah,
And
that's another thing, age factor. You think, oh my God, I'm feeling weaker. I don't feel as like I can be as fast, but
well, or that,
yeah.
yeah, or that you'll ever even get back to normal again. So many people that we work with, they believe that they've been cursed with this destination. There's no way to unravel it because they've done so much damage. And the beauty is that that's not the case at all. A lot of it is just re-educating the way that the body interprets movement,
Right.
and doing it long enough. And that's the issue. The issue is not the fact that the protocols that you were doing with those other practitioners were wrong. Most likely they were giving you the right protocol to solve the problem,
Sure.
but it only gets you to a certain level of function. Because the reality is, it's not just I get you out of pain and now you go back to your tendencies, because it was partially your tendencies that got you in trouble in the first place.
Right.
So
right.
if they didn't educate you on what the mechanisms were that got you there in the first place, you're going to go back to your own devices, create the environment again that led to the injury, and then go back and see them again. And again, you're in that hamster wheel of, put on the Band-Aid, fix the solution, or create a temporary solution, go back, injure. And you're back and forth, ping-ponging back and forth between injury and recovery. Meanwhile, you're never moving forward, and you're always second-guessing, and you're always worried about getting hurt because you're never going through the full process. So our system says, okay, well, we know that there's different levels of proficiency and the way that the body moves in different levels and stages. And so we have a way of qualifying what that movement and exercise intensity should be based on your faculties and your ability to replicate a standard that's going to be sound, and the first priority being no harm for your body. So once we know that your range of motion is sufficient, the recruitment capacities of your muscles and the capacities of your tissues can withstand the forces, then we challenge it so that your brain can then start coordinating the way that the body moves the right way and starts to rely on a pattern that is efficient and non-pathologic.
Okay.
Therapeutic.
So I have a question, because based on my injuries, like with my back, it was the ligaments that got injured, and with ligaments, they don't always heal, right? So you have to work around that area, and that's what you focus on.
Well, remember, what is a ligament? A ligament is basically the break of last resort for a joint. So essentially, it's a ligament is a connective tissue that attaches a bone to another bone. So if you work through all of your muscle, which is normally the front line, right? They're like the front soldiers. If they're not doing the job the right way, what's left? The ligament, the infantry, right? So you've got this last thing. And the thing is, the ligament takes the burden of it. And if you strain or stretch it, it's very viscous. It's not very capillary. It doesn't have a lot of blood flow. It takes a long time to heal.
Right.
Right?
If it does,
If it does. And once it's stretched, it takes a long time to restore it. Now, the main thing is what stretched it in the first place, and what was the disorganization of the muscle firing pattern that led to the additional strain on that ligament that led to the reflex guarding, because the ligament was now hurt. And it's called ligamental muscular reflex. So once you strain a ligament, the muscles that oppose that action, they upregulate to protect it so your body doesn't go back to putting strain on that ligament. And that messes up your movement even further and leads to injuries everywhere else, because now everything is compensating.
Right.
So a lot of times you get these multiple symptoms going on, and people are like, I don't know up from down. I don't know how to recalibrate from is it the chicken or the egg? Do I start with the ligament? Do I start with the movement? Well, it all goes back to a simple process of efficiency and movement that's coordinated from the inside out, and going back to the reflexes that we want to develop and the way that the muscles are supporting the joint motion. And that joint motion is profiled against optimal. So you can look at each segment independently and identify its qualities, and now put those segments together in a system and look at how that system functions. So if there's dysfunction in the system, break it down into its smaller component parts, and then identify where the distortions are occurring. And those identifications are normally deficits in mobility, or there's deficits in strength. So once we know that, We have to identify why is there a deficit in mobility and why is there a deficit in strength? Well, the deficit in strength could be that you never worked the muscle long enough because you chose to do other body beauty areas.
Right.
Areas of emotional importance. We see people all day long because of that, because they overtrain one area over the other because they're trying to chase vanity. Okay? Don't do that, by the way. That's never good. Okay? Stop doing your pecs and biceps, guys, because that's going to jack up your shoulders.
Yep.
And stop doing hip openers on your hips to try to target your gluteals, because that's going to impact your pelvis's position too, right?
Yeah,
so the point is
posture.
It's the tensional balance between them. And so the point, though, is that once we know where that imbalance lies, we have to question, why is it going on? So why is the muscle shut off? Is it because it's weak, or is it because it's being neurologically inhibited because of that pain from the ligament, because of the distortion of the upregulation of the muscles that oppose that ligament? And then once we know that, we know what the culprit is, and we know what we need to do to rebalance those tensional forces, to normalize the position, to restore the function of the joint center so that the ligamentous connection can eventually shore itself up. Which means if there's a lack of stability at the terminal extension of that joint because the ligament's strained, do you think it's going to change the way we ask you to move? Absolutely.
Yes,
you're going to reduce your range of motion until we know you can control it through that front line set of muscle, until again the body can support the position and then restore the length of that ligament, which could take up to 2 to 7 years. Right? So that means if I'm going to put you into ballistic activities where your muscles aren't coordinated efficiently enough to hold that joint position, that it relies on that ligament, probably not a good idea to put you into that level of exercise intensity. And that fundamentally is the difference between going back to activity, sport, or performance, like you would do if you were coming from a traditional PT environment.
Yep.
They've given you a series of exercises to restore the function of that area, to maintain the posture of the joint, but not movement and not coordinated involvement back in activity. So you're good with a certain level of force through it, but then you go back into everyday activities. No one's trained you how to replicate that standard with different forces acting through it. And so you go back to your known standard, and what do you think is going to happen? Right. You're going to re-injure and you're going to go back to the beginning. So the gist is you have to know first fundamentally what the form and structure and anatomy is, so you understand what you're working with. If you don't know the component parts, you don't know how to manipulate them. Right.
Then
once you know that, then you can coordinate them back to optimal.
Sure.
Yeah, so go ahead.
So with all of that in mind, you guys are ahead of the game as far as being able to identify how people are moving. Explain to everybody, like, you know, what you do from like start to almost finish, like going when somebody goes to your website with an injury, or if they want to optimize their fitness, or they feel like they're out of shape and they just want to get back into the motion, and you can help them.
Yeah, so it's a full spectrum service, multidiscipline, multifaceted, or multimodal, right? Which basically means we got to look at all the contributing factors that can keep a person from healing, right? And so we have two basic pathways. We have a physio pathway and we have a wellness pathway. No matter what, you're all going to end up on your wellness pathway, because the goal is to get you out of dysfunction and then optimize your function, right? The net goal, no one ever comes to us and is like, I just want to do just enough not to be dysfunctional. No, they say, I want to return to an ideal life that's filled with mobile autonomy, and they can do whatever they want with their body without fear, without feeling like they're going to be out for a week, without sparking something up, or, flaring something. That's such a common thing. Oh, my back flared, right? Well, what created that flare? Aren't you ever worried or interested in what was the mechanism behind that flare?
Right. You want to do maintenance for life. You want to be able to, what you're learning is like for lifelong. For
lifelong.
Yeah.
Yeah. So again, to your question, the process is first figure out where you're at in your state of function. So we ask a series of questions. There's an onboarding health history questionnaire. We look at back history. We look at occupational redundancies. What are your hobbies and goals? So how do you train? How do you move? Are you sedentary? Are you mobile? We need to know, what are you doing with your life? Right? How do you approach food? Food is a source of energy, but it's also a source of inflammation. If you put the wrong things in, it can create systemic inflammation. That's going to keep you from healing. We got to figure that out. We got to know, how much emotional stress are you experiencing? Because that's going to change your hormonal relationships, your endocrine relationships. That's going to change how your body heals. If you're always in stress, You don't have the hormone substrates to promote protein synthesis.
Right. Now, not to interrupt, but for somebody who's watching this, they're going to think, oh my God, you're working on nutrition, you're working on like wellness, and you're working on fitness. It's going to cost an arm and a leg, but that's not necessarily true with your system.
No, and the goal is to put the priority towards what is most significant at the state that you're at in your wellness journey. Yeah. So we could throw the whole house at you and all the kitchen sink and all the other tools and baubles that come with assessing and tracking and modifying. And right, what you have to do is set a baseline by measuring the quality of whatever that system is against what your standards are. Mm-hmm. So we do that metabolically. We look at the way your body uses energy. Okay, we look at your biomechanics. So we watch how you move and the efficiencies of your movement. We look at your nutrition and how you support your macronutrient profile for energy. So how do you maintain body composition by feeding your body with the right resources? And then ultimately, how do you manage your life and your stress relationships, and how can you control your emotional disposition so that it doesn't derail you from your agenda or sabotage you, because we oftentimes have sabotaging behaviors when we don't feel aligned with the process, right?
Right.
So it's looking at how to get people into that mindset and looking at where are your needs in each of those buckets and what's a priority. Normally what we start with is movement. So the logic is, in order to condition your internal systems, like your hormones, your nervous system, and your circulatory system, and all the systems that keep you alive, they're called your homeostatic control mechanisms. I need to move my body to do that, right? I need to stimulate an adaptation through action. But if I can't move my body because my biomechanics are fundamentally wrong, so that if I move, I injure myself before I can accomplish the amount of loading through these interventions to create that adaptation, it's a futility, right? You're not going to get anywhere. So we always start with movement quality. We start with biomechanics. We start you with a core 6 movement analysis where we grade your joint motion independently. We measure the joints against each other. It allows us to figure out what the interdependency is through the forces through the body, so we can see how the body chooses its path of movement.
Sure.
And then we measure that against optimal. And if it's not, then we re-educate you on how to bring it back. And by doing so, it takes the mechanism of injury away from the body. It establishes a neutral environment for the tissues to heal. And then we encourage you through lifestyle, nutrition, and behavior recommendations to optimize the outcomes, and then incrementally add those pieces in as you're able and willing to, right? So it's about figuring out the resources for the individual when they're ready for it, and then making sure that they have the time and the financial resources to support it.
Right. So when somebody signs up, you give them a username and login to go into your portal. So do you want to explain, so that way they can visually see what's going on? They can take classes for yoga, meditation, and nutrition.
Yep.
And they can also watch videos, like self-help type videos. So
yeah, we basically are trying to throw everything we can at you, which is, there should be no reason because you don't have enough resources to understand what to do.
Right.
So to your point, we have private sessions where we work independently, whether it's a physical therapist working with someone, it's a movement specialist, a massage therapist, a nutrition coach, a registered dietitian. We have all those team members to work with an individual. Mm-hmm. We also have group classes that are streaming.
Yep.
And what we've done is we've created a movement system. So when you do your analysis for your movement analysis and you get your grades for each of your joints, those grades align with our smart class format. So even though you're in a class and you're participating with other people, we can still give you custom content specifically for your movement imbalances, which allows us to reduce the cost, and you still get value for it, and it's progressive. So you can see the physical adaptation transpire. And then every 12 weeks, we reassess and evaluate where your movement quality is, and then reset the levels to, again, accommodate the level of exercise intensity that's right for you.
Okay.
So,
and you do this in-house in Minnesota and online. I've done the online. When I've taken yoga, the teacher can see what I'm doing and can make recommendations like you just mentioned. Like it's like you're there. It's like you're there. So that's really great.
Yeah, our specialists have developed an eye for looking at the bony marker structures. So you can see where your movement occurs just by the way that your joints position themselves. Okay. And we measure the joint position against your body's vertical center of gravity. So once you start to define where those structures are, you can start to see where the forces are acting on the joints and how they're manipulating the body. So even though we're not physically there with you and we can't move and palpate and adjust and actually do muscle manual testing, we can see it show up in the way that you organize your movement, which allows us to still be effective, to give you quality feedback and to give you specifics based on where your body's at. And so we use that virtually, and we're able to do a tremendous amount of good because we teach the techniques for self-mobilization to restore the length of these tissues, and then show you how to stay within functional ranges of motion so that when you're going through these positions, you know how to protect your body and stay in the range of motion that's going to be appropriate for you.
Okay. Now, just to go over a little bit about you, you're a national presenter. You have amazing, a number of videos online and on TV, Roku, Amazon Fire, Apple TV. You have your own channel, and you're also a celebrity trainer and have worked with cancer patients.
Yeah, so background is in kinesiology, and the goal being to kind of bring up the game of the athletic training paradigm. I originally started as an athletic trainer with the expectation that I was helping people to get healthy. My background, I come from a family who has got morbid obesity and cardiovascular disease, and so that's one of the impulses behind my decision to go this route with my career. It was near and dear to my heart to try to figure out a way to help people, your average person, retain health or get back to health. And so with that as my motive, I noticed that in this athletic paradigm, individuals were constantly getting hurt, right? They were constantly, like you said, you went back to training and you would always get hurt. And so you see this all the time. And being a first principle thinker and again, a lifelong learner, I started looking at that and thinking, okay, this isn't right. This is not the right system. Something has to change because right now we're just churning out injured people. And what's the association? What do we need to do to correct for that?
Right.
And so that's where the ideology came up, or where we came up with this ideology is what is necessary to create a path of wellness that takes incremental steps and shows a person how to put it into their life, have context so that they have belief. Because if you don't understand what you're doing or know why you're doing it, it's going to be hard to keep doing it.
Right.
So teach them the context, get them to understand the principles, apply the principles, showcase the improvement on our dashboard. So we take information and we track your history so you can see improvement and you can see it over time. And it gives you that confidence that what you're doing is leading to a bigger picture.
Right.
Because a lot of times these things that we're doing are so small and seemingly insignificant that it's hard to think about how they're going to all add up to the big picture until all of a sudden the pain's gone, the movement's back, the load's through the body, the weight's coming off, your circulatory systems are improving, your energy balance improving, all the things that we associate, right?
Right. Or inflammation is gone, like my knee.
Right. So you take the environment off of it and the body does what it's supposed to do. It heals. It does. And that's the thing, is just put the good inputs on. So really, long story short, what I found was that we wanted to begin at the front end where people were entering that path of return to sport, return to activity, return to life. And that means that we wanted to be in control of the outcome from the very beginning to the very end. And that's why we offer physical therapy services in-house now, both physically and virtually. And we can do assessments and analysis over the phone through these virtual interventions, right? And then we can start doing the actual protocols online. So now we do this nationally and internationally.
Yeah, that's fantastic. So this is literally for everyone. I imagine children, middle-aged people, elderly people, and more people with illnesses or immune system.
Anyone who moves.
Yeah, I think that this can help. I personally think this has helped my immune system. And, with COVID going on, I think that when you balance everything out, it makes sense, right?
Yeah, the body works together. It doesn't work independently. So your circulatory system is not somehow magically removed from your biomechanics, right?
Yeah.
Your endocrine systems are directly related to the way that you move. Your posture isn't just some vague nebulous concept. You're literally maintaining forces through these tissues that require energy. And if the forces through the body are disruptive, the body is not adapting to that disruption in a positive way.
Sure.
It either can reinforce negatives or it can keep you from maintaining good health. Classic example is just your diaphragm and your abdominals. If your abdominals are weak and your ribs are elevated, your diaphragm is suspended and taut. Mm-hmm. That's going to change motility and digestion and oxygen saturation and neural engagement of your parasympathetic nervous system, hyperdiaphragmatic expression, so you're never getting all the carbon dioxide out of your lungs. So then you're saturating your bloodstream with carbon, and then you're not using oxygen for fatty acid utilization, which means you start to use sugars more, which then your body has to balance through the release of more insulin, which is highly inflammatory, which leads to insulin resistance, which leads to cardiovascular disease. It just goes on and on and on. Right. It's all connected. Everything is connected. They're not separate. And what we have to do is think about how do each of the pieces fit together and be mindful about how we approach the solution for each component. And that's the big picture takeaway, I think, for our organization is saying, let's not just pretend that these things don't have an impact. Let's get our head around all of it. Right. Let's scrutinize each of the components. Let's give it a base to work from. Let's tell you how it's interacting with the other systems, and let's help you have the knowledge to make a choice as to whether it's worthwhile to you.
Right. And it's on a personalized level. It's for that individual, no matter what they've experienced or gone through.
Exactly. And to your point, this is not for one person or one group. We often get that question. Well, what if I'm working on my shoulder with a physical therapist? Should I be doing this with you? Yes.
Yes.
Most definitely. We're restoring your body so that this can heal as best as it can, right? Now, obviously, there's contraindications, and we would work within the scope of their practice. But the point, though, is that, yeah, you can work that in.
Yeah, right? Because of all that whole balance. Like with my hip, where I'm like going one way and my body's trying to pull the other way, and
Well, yeah, there's only so much time in a session. So you're working with that PT on that shoulder position. Well, where's your trunk and where's your hip? Because the basic support for that shoulder is going to change based on where your trunk and your hips are. Yep. So maybe we work through the trunk and hips to get the forces to be neutral through the rest of the body as they're working on this. So it doesn't matter where you come from. Let's say you would have no pain. Well, let's keep it that way.
Right.
Let's prevent. Yeah. Let's get ahead of it.
Yes, definitely. Especially as you're aging, and you never know with a car accident or anything.
Well, and the reality is that all of us have asymmetries. Not one person in the body is balanced. Not one person is fundamentally balanced.
Right.
We're all anatomically deviated, and so we have to figure out how to balance those forces. We teach the balancing, and that means you do it whether you're in pain and injured, or the symptoms are there, or the symptoms aren't there, but all the signals are pointed in the same direction. You had high blood sugar for decades before you started injecting insulin, right? And if you had someone that could have gotten to you 2 decades before and said, listen, this is how you're going to correct for it, before you have to face the consequences down the road,
right,
where you don't have choice over it. Right now, these tissues are compressed and strained, but they're not torn and they're not dysfunctional to the point of never going back to return.
Right.
If I can capture that person and restore the quality of their movement to reduce the risk associated with these problematic areas, they may never experience that setback ever in their life. And for me, that's really what the message is. We don't want to just have to deal with the consequences of poor movement. We want to get ahead of it before it happens, teach you what to do, and be more mindful about it with precision-based, mindful exercise. And that, I believe, is going to be the future. It won't be the body beauty and the dysmorphic idealism that we see with a lot of the sports paradigms that are current in the industry.
Right, right. Well, that's great. I mean, I can't thank you enough for everything that you've done for me.
My pleasure.
And I'm still a work in progress, and I need.
We all are.
And this is a lifelong thing. And as you taught me, is like repetition for those muscles to get to know. But thank you so much for coming on the show.
My pleasure.
For more information, people can go to fluidhealthandfitness.com.
Fluidhealthandfitness.com. Yeah.
Yeah. And can they go anywhere else and connect with you or try to find you? YouTube?
Yeah. So again, we do have the channels out and live. We also have a YouTube channel. We do a complementary movement analysis. Mm-hmm. So we offer everyone ability, if they want to reach out, they can go to admin at fluidhealthandfitness.com,
That'll be on the
or
screen. Yep.
or member support at fluidhealthandfitness.com. And then we have a representative that will set them up with either a physical or virtual consultation.
Okay.
It normally takes about 30 minutes. You'll do a health history questionnaire. We give everyone a 2-week free trial to come in and see the classes if they want to and take it on.
Right.
At a minimum.
And you have the software to be able to see how their posture is, how they're moving. Yes.
Yeah, so they're moving in real time right in front of us, and we're actually cueing them and giving them feedback for their particular movement bias based on the Core 6 analysis. So they get to see it firsthand. Right now, we live in a world of COVID, right? We live in a world of restricted movement. There's lots of people who don't have access to the resources they once had. Right. And this may be an opportunity to actually take another or look at another way of approaching your health and wellness.
Yep.
And, we had an individual, and we'll kind of maybe wrap with this, is there's a gal I met that came in from England and started working with us, and she was not an exercise enthusiast. She was not a person who identified with movement, right? Mm-hmm. So, you either are or you aren't. This wasn't her bag, right? And one of the beautiful things that she said, was she's like, I went to a gym and I started to try to do exercise because my age is catching up. But I went in and I did it way too hard, and immediately I hurt myself and I became scared, and then I didn't do it at all and I gave up.
Right.
Like, this is a different way of approaching it, where it's more about awareness and restoring and taking care of your body as opposed to punishing it.
Yep.
Right?
Yep.
We're nurturing it, we're restoring it, we're preserving it, and the side benefit of that is weight loss, is no pain, is length of life, is improvement in quality of life. You treat your body well, your body treats you back really, really well. You just need to make sure you put the right inputs in, take the wrong inputs off, and it will take care of you. Yeah. And we just want to help people put those inputs in.
No. Well, that's awesome. So thank you so much.
Yeah, my pleasure.
Great. Do you mind if we show a clip of your, like one of your commercials on your...
Oh, yeah, absolutely.
Hi, my name is Ryan. I'm the founder and owner of Fluid Health and Fitness. When someone completes the rehabilitation of an injury, it's common that they feel apprehensive about what to do next. They're ready to get back into their routine, but they may not be fully confident in their abilities to transition back into their everyday life activities. That's why at Fluid Health and Fitness, we've developed a program to help you through your transition. Using our motion capture system, you will see in real time how your motion compares to ideal motion. We have a proprietary movement system that adapts and develops exercises that allow you to perform your activities more easily and without the risk of re-injury. As your body evolves, so does our program. Based on your assessment, you'll be given a tailored exercise protocol which matches your individual abilities. With this approach, you can be confident that you'll be given the right exercise at the right intensity and at the right time.
So thank you so much. And again, make sure you go to Fluid Health and Fitness, get 2 weeks free to get, which was absolutely valuable. It's changed my life. I can't even tell you how much. I'm glad I don't have to get the injections in my knee or a knee replacement.
No.
Yeah.
Yeah.
I'm too young for that. I'm way too young for that. So, but yeah. I highly, highly, highly recommend what you guys do. I just can't tell you enough how much I appreciate everything that you do and what I've learned. And I have a lot more to learn and keep going because I have a ways to go. So,
well, we love having you here, Laura, and thank you for taking the time. And just remember, your body's designed to move. So you just have to learn how to stay in motion and don't think age is a limiting factor. It's not. Yeah. Right.
Yeah, exactly. So thank you so much. Thank you.
Yeah, you're welcome. Talk to you soon.
Okay.
Bye.
Bye. Thank you again for joining us. And if you're just tuning in, make sure that you catch us on the web at yourbusinesstv.com. That's yourbusinesstv.com. And we'll see you next time.